The technician's role in the dental service is something that's changed over the last several years. It used to be where the technician pretty much did everything, and including extractions and some surgical procedures. And that's been pretty controversial, and there's a paradigm shift that's occurring, and we need to keep up with that paradigm shift and really define what our role is that's appropriate in the dental service. And so we're going to talk about that a little bit and see, where you can be the most effective and still be within the guidelines of your credentials. So we've always heard that this was primarily a technician task, and in still some small animal practices, it is still primarily a technician task. We find that there are some veterinarians that just are not interested in dentistry and would rather not participate, and so they kind of put all of that on the shoulders of their technician. And we really have to rethink this, because there are some state guidelines that lay down pretty specific guidelines that technicians are not allowed to do extractions. But then there are those guidelines that say that technicians are allowed to do extractions as long as there's veterinarian supervising, but technicians are still clearly not allowed to do surgery. The problem with that statement is it's a little bit ambiguous, because in pretty much every situation, an extraction is a surgical procedure, and I'll talk about that. So those statements are kind of contradictory, and we need to kind of rethink how we're doing our dentistry and the procedures that we're performing. So let's talk about what our role should be and how we can be the most effective with workflow and an appropriate task that we should be doing as technicians. Of course, we're going to want to talk about it in the exam room with our puppies, our oral exam, yearly exams, annual exams for vaccines. We're going to want to stage mouths, and this works very nicely for procedures when they're booking maybe 2 weeks or 2 months down the road, and our front staff is usually booking those appointments. So to make it a little bit more effective, time management a little bit better, what I suggest is when you're staging those mouths, and we're all using codes in a computer when we're using either our travel sheets or doing our final medical notes. A lot of practices are paperless now, but everybody's using some sort of computer system. And so I recommend creating computer codes, ST1, ST2, ST3, ST4, stage 1, 2, 3, and 4. And so we can put that in as part of our physical exam, or the veterinarian's physical exam. And so when those clients call back to actually schedule a dental cleaning, then we can teach our front staff or whoever is booking those appointments what is an appropriate number of procedures and type of procedures for a particular day. For instance, we don't want to just schedule 2 stage 1s in a day, because that's kind of, not really going to be a productive day. And yet we don't want to schedule 3 or 4 stage 3s on the same day, because those procedures can be in upwards of an hour and a half to 2 hours each.